Assalamualaikum warahmatullah. Bismillahirrahmanirrahim. So today's video is on cyclic vomiting syndrome. So this is characterized by episodes of severe vomiting which have no apparent cause. So the episodes can last for hours or days and have alternate symptom-free periods. They are similar as in they tend to start at the same time of day, last the same time of length, and have the same symptom intensity. So it occurs in all age groups, though usually in children around 3 to 7 years old. It's difficult to diagnose because vomiting is a symptom of many disorders. So treatment can involve lifestyle changes to help prevent events that trigger vomiting episodes. So anti-nausea medications and migraine therapy can also lessen symptoms. So symptoms include intense nausea and sweating before an episode starts, abdominal pain, diarrhea, dizziness, sensitivity to light, headache, retching or gagging. So the underlying cause of cyclic vomiting syndrome is unknown. So this could include genes, digestive difficulties, nervous system problems, and hormone imbalances. But some specific bouts of vomiting can be triggered by cold, allergies, or sinus problems, emotional stress or excitement, anxiety or panic attacks, certain food and drinks such as alcohol, caffeine, chocolate, or cheese, overeating, eating right before going to bed, or fasting, hot weather, physical exhaustion, exercising too much, menstruation, motion sickness. Complications include dehydration, injury to the food tube, and tooth decay. So dehydration, so excess vomiting can cause the body to lose water quickly. So severe cases of dehydration need to be taken to the hospital immediately. Injury to the food tube, so the stomach acid which comes up comes out as vomit can damage the tube that connects the mouth and stomach, known as the esophagus. So this esophagus becomes so irritated it ends up bleeding. And tooth decay, the acid in the vomit can corrode tooth enamel. So prevention can include medication such as amitriptyline, propranolol, cycloheptadine, topiramate. Lifestyle changes can also be given, such as getting adequate sleep, avoiding sugar foods, and eating small and low-fat snacks daily at regular times. For diagnostics, it's difficult to diagnose, but you can have imaging studies, so an endoscopy, ultrasound, or a CT scan to check for blockages in the digestive system. Motility tests to monitor the movement of food for the digestive system to check for digestive disorders, and lab tests to check for thyroid problems and other metabolic conditions. Though I must say it is difficult to diagnose this condition in particular because of the vomiting being a sign of many other conditions, so it has to be ruled out first. So there is no cure, but people who have this will end up having anti-nausea drugs, pain relieving medications, medications that suppress the stomach acid, antidepressants, anti-seizure medications. Sometimes even medications used for migraines can help stop and prevent episodes of cyclic vomiting. So this can be recommended for people whose episodes are frequent and long-lasting, or for people with a history of family migraine. Intravenous fluids can also be given to prevent dehydration. So treatment is individualised based on the severity and duration of symptoms as well as the occurrences of complications.